think there's a lot of stress, particularly for medical students at the moment, about future careers and difficulty getting jobs. And there's a lot in the news about that at the moment.
If you can explain something really complex in a really simple way, for example, in anaesthetics or surgery, it's all going to be something that they're looking for.
I like the breadth of the different conditions you can see. I feel like it's an intense environment, but I just get bored quite easily.
Hi, my name's Mike, and welcome to another episode of Coffee on Call, the Foundation Medicine podcast. Today we're going to be talking about careers in medicine, and with me is Elwyn.
Hello.
And Ruby.
Hi.
So before we can talk about a career in medicine, I think it's important to first of all get an overview of the structure of a career. So can you just talk us through what it's like having a career in medicine and the kind of structure?
Yeah, so we all start from medical school, 5 or 6 years. And then after that, you have the foundation program, and then you have the core training, and then you have the specialty training.
Don't forget the locum year for fun.
Oh, yeah. That's becoming very popular now. But yeah, that's just there's stages to it, but essentially it's foundation, core, and specialty training.
So with that structure in mind about what the career in medicine looks like, Ruby, do you have any plans for the future about what you want for your career?
Yeah, so with my career, I've kind of always wanted to be a surgeon. And I think more recently I've been looking into alternative career paths because I think surgery is really practical. You don't necessarily get exposed to that, so I'm not sure necessarily yet if I'm cut out for it. But I think that comes with time and practice and courses and things, so that's not putting me off. But yeah, I think it's important to have a look around, and I've also been looking at anaesthetics as well, which is equally as practical and in the same kind of environment and pace, but just is a little bit less focused on necessarily the procedural side of it.
Okay, but you're very much leaning towards surgery, hands-on kind of element.
Yeah.
And what about you, Elwyn? What are you looking for next year?
I have to say I'm a bit of an adrenaline junkie. So I kind of really like A&E, so accident and emergency. I like the breadth of the different conditions you can see. I feel like it's an intense environment, but I just get bored quite easily. I don't know if it's just a behavioural problem. Maybe I need to go see my GP. But yeah, I really like A&E. I'm on GP at the moment. I'm enjoying that to a certain degree, but it's probably not got the level of adrenaline that I'm probably searching.
Okay, so you like the excitement and kind of the variety of A&E. Okay.
And on the practicality, like suturing, like you can do like a lot on A&E.
You're not a bit scared to do A&E forever though? You're going to have really big eye bags.
Yeah, might need to consult some people to help with that.
I can do surgery if you let me near your eyes.
Okay,
I'll stay away from that.
So we've got a surgeon and an A&E doctor. I feel like I have to just quickly justify medicine because I'm wanting to do medicine.
Ooh.
Yeah, I know, everyone says that. But I do think it's very interesting. It's very varied. You get the chance to go into more detail with each patient. So that's why I'm leaning towards medicine. But I fully appreciate there's more skills in other specialties.
No, big respect to medicine. I'm on a medicine job right now and absolutely love it. And I think all the consultants massively look up to. I think they're great. Yeah. And I did a cardiology job and loved that. But I just think for me personally.
Yeah, we all got to work together at the end of the day. It's all about, looking after patients.
Absolutely.
And there's sometimes, arguments between politics is probably the correct term.
Yeah.
But, sometimes you've got to put that aside, think about your patients and get on with it.
Give them the best care.
And we've talked a lot about different specialties we're thinking about going into, but I think there's a lot of stress, particularly for medical students at the moment, about future careers and difficulty getting jobs. And there's a lot in the news about that at the moment. So how are you guys sort of preparing for the future? How are you sort of building your portfolios to get these jobs that you're interested in?
Classic question.
Saying yes to everything. Look at me, I'm on a podcast. This is where you get
Straight
your points.
on my CV.
On the CV.
I think it does. I think it starts early. Like you've got to start thinking about it in med school, and if you haven't, that's fine. But a lot of the things you did anyway for fun will have been things that you can use if you frame it right. So, for example, playing a medic sports team or being on a position on a committee, whether it's an academic society or not, can all be really useful. And then just taking opportunities in your foundation years to teach med students informally at the bedside or arrange teaching programmes. Trying to seek out opportunities and look early into what kind of you're going to be scoring points for, I think, is important.
Yeah, definitely. Seeing how you can use your strengths to your advantage. Yeah. What about you, Alan?
So, pretty much the same things because remember, it doesn't matter what you do, what is required for your portfolio is pretty much the same, projects.
Quips, audits, that all comes in foundation. There's so many things going on.
But at the end of the day, all of that is great, but you also need to make sure that you've got the communication skills, you've got the, you know, you got the confidence, you've got the confidence in your abilities, which comes with experience.
Yeah.
And that all comes out at interview. Like I feel like interviewers
Exactly.
can really tell.
Exactly. We don't
if
want
you'll go-
robots.
Yeah, if you're going to be good, if you can explain something really complex in a really simple way, for example, in anaesthetics or surgery. In medicine, if you can explain how all three conditions interact, it's all going to be something that they're looking for, being a whole person.
And we've kind of touched on how difficult it is to get into training at the moment and the difficulties there. Do you guys have a plan B if you're not able to get into training straight away? What are you thinking about doing to build your portfolio and build your career further?
Well, for me, I didn't apply this year, but I would really consider doing another year in education. I feel like that makes me a better doctor. And it keeps all my information up to date, so things like that. And then potentially looking at sitting some exams. If you're doing a locum year, I feel like that's always really useful.
Okay, what about yourself?
For me, it's just about building experience, trying to figure out what I want to do. I think a lot of people, if you're honest, and everyone, the golden question is, what do you want to do? You know, the public will ask us, what do you want to do? And for so long, I genuinely didn't know what to say. I was just honest. I said, I don't know what to do, genuinely.
And it's okay not to know.
And it's okay not to be the cardiologist or the cardiothoracic surgeon that everyone thinks is, you know.
Loads of people don't know what they do when they start.
And loads of people say they want to do something and then
it changes.
they don't do it.
So we've spoken about a lot there. There's a lot of different careers, and you know, best of luck for the future for both of you. Just to finish off, if you could go back now, before you went to medical school and you weren't going to go into medicine, what career do you think you'd choose and why?
This is so funny. My fifth choice was actually ancient history and classical archaeology, so I would definitely want to be Indiana Jones.
For me, it's about sport. I'm really sporty, so I wanted to be the next Carlos Alcaraz. So if I could, I would want to go into like professional, like being an athlete, like a sports.
Well,
like
it's never
tennis
too
player.
late. Never say never. You never know.
I've got a tournament coming up. So.
Well, best of luck.
Yeah.
Well, thanks very much for talking today, guys. Thanks very much. We'll see you at the next episode.